Joining us is Utah Congressman and family medicine physician Mike Kennedy. Welcome, doctor. Just help us, those of us who did not do well in math and science and did not go to medical school. What are Obamacare subsidies and who gets them?
Congressman Gowdy, it's great to see you. I'm glad to visit with you. Big fan of what you do. And you knew at the beginning in 2010, Obamacare was a stinker. It was going to be bad. You voted against it. My friend Congressman Chaffetz voted against it as well. And as a family doctor myself, I knew it was going to be bad. And 15 years later, here we have Chuck Schumer shutting down the government for $1.5 trillion given to insurance companies to subsidize Obamacare. And if anybody wants to wonder if the Affordable Care Act is affordable, you only have to look at this shutdown nonsense and $1.5 trillion demand to subsidize it to make it actually work, to realize it's the Unaffordable Care Act, not the Affordable Care Act. So most people, I'll just say, when it comes to these subsidies, they're going to, 93% of the people are 400% of the federal poverty level or lower, and 93% of these people are going to get their subsidies as before. But if you're making $600,000 a year as a married couple in West Virginia, you're not going to get your subsidies this time around. The fraud, waste, and abuse in this program is rampant, and we need, as Republicans, to step into the fray and fix this program, which is a disaster for the American people.
You know, even though I'm a lawyer, I actually love having doctors in Congress. I love serving with doctors because they bring a perspective that sometimes the rest of us don't have. It also proves our party is not a monolith. I mean, there are different views under even the health care tent. Health insurance, access to health care, how would you describe it? It's not a right that's enumerated in the Constitution. Is it a privilege? Is it statutory? How would you describe to a constituent what access to health care is?
Access to health care is vital for everybody, but I'll just remind you, Trey, and everybody else, that the primary driver of health care should be the individual. And this gets me to government policies like SNAP, where the #1 purchase on food stamps or SNAP, Supplemental Nutrition Assistance Program, #1 purchase is soda. The #2 is candy. And my question to the people that are listening today, and to my patients when I talk to them regularly, is that a good idea for us to, as a government system, to subsidize people to buy some of the least nutritional value, worst drivers of healthcare, soda and candy, so that they can buy it on the government dime and make themselves sick? And then guess what, Trey, you already know all this stuff too, is that when these people consume more soda and candy, diabetes, high blood pressure, they have heart disease and strokes, and that leads to, what do we have from these people? Medicaid. They all are on Medicaid, and some of them are on Medicare, and the government is going to subsidize their health care on that side. We know that anybody that goes to the emergency department is going to get care, and I've donated my time to a voluntary care clinic in Provo, Utah, in my district, that actually we give away free care on a regular basis, but health care should start with the individual, and that's why I'm a big fan of high deductible plans and health savings accounts. These actually fundamentally are things that are going to transform healthcare, and we need to promote those policies, which are actually going to drive people to take more account, not only for their own healthcare, but also for the cost of their healthcare.
Well, like a good, smart doctor, you anticipated my last question, which is, if you could design a plan, what would it be? And I heard high deductibles. I mean, we don't expect our homeowners insurance to pay for every repair at our home, but for health insurance, for some reason, I mean, even paying a $20 copay gets people's eyebrows raised. High deductibles and let the individual interact with the insurance company. That's what I hear you saying in terms of a plan for health care.
Right on, and we're working on that as Republicans, because when people have skin in the game, when they have health savings accounts, that their money is in there and they can use it in their own fashion. And I've seen it literally in my office when people have high deductibles and they're accountable for these charges. When I'm ordering tests, they ask me how much those tests are going to cost, and I tell them how much those roughly estimated, how much those tests are going to cost. And these people and my patients and I have a conversation about the cost cost of their health care. This third-party payer process where nobody cares, the doctor doesn't care, the patient doesn't care, but the insurance constantly is, in my case, prior authorizations and refusing to grant the patients access to labs or tests that I feel like they need, and I've had that for 25 years as a family doctor. We have to get the customer, which is the patient, in charge of not only their own health care, but also in charge of the costs associated with that. And high-deductible plans with health savings accounts will do that.
Well, thank you for being smart enough to be a doctor, but also willing to serve in Congress, because that's an unusual combination. So thank you for your willingness to do that and joining us on a Sunday night.
Pleasure. Thanks, Trey.
Hey, Sean Hannity here. Hey, click here to subscribe to Fox News YouTube page and catch our hottest interviews and most compelling analysis. You will not get it anywhere else.